The EFI is it stands for the Electronic Fealty Index, and basically just captures it. It's what's called a cumulative deficit model. So the idea is that there are about 36 items that can be captured. So there's an element of it that is quite dependent on the accuracy of coding, but essentially you're kind of capturing a variety of symptoms, a variety of diagnoses, and that comes together to give you a score, and you're able to sort of categorise people as fit, mildly, moderately or severely fail, and clearly the degree of frailty can correlates with the increased risk of somebody either being admitted to hospital or to institutional care. We use it in a number of ways. At the moment our lists are generated for us, capturing a number of categories. So we get a list of the patients that have moved from being mildly frail to moderately frail. Also of those patients who have shown a significant deterioration in their score within the moderate group. We also look at new patients to the severely frail group. And so we look at those lists, and about once a month we meet with colleagues from the community mental health team, district nursing, social work and the voluntary sector to discuss those patients and how potentially we might try and work together to meet their needs and improve their quality of life. On a Tuesday morning, we already have a clinical meeting. So we sit down with the district nurses and discuss patients. So what we tend to do is, at that meeting, identify patients who potentially would be suitable for discussion at the frailty multidisciplinary meeting, which is what we call it. And equally, I would send an email round to colleagues to see if they've come across any patients who they feel may be suitable for the meeting. Because I think the tool can be helpful, but equally it shouldn't take the place of clinical judgment. And if people are out in home visits or have seen somebody within the surgery who we think potentially could be helped, then they're perfectly able to refer them to the meeting. The other thing, of course, is now that within our IT systems, we're actually able to generate a frailty score at that moment in time. So again, it's a useful way of kind of checking your clinical judgment to kind of match what your perception is against the frailty score. There's two elements to that. One is, I guess, there's the process, which is actually meeting with colleagues, which we weren't doing before we started engaging with the frailty tool. And I think that's good on a number of fronts. It's good to develop relationships and generates a greater understanding of what colleagues do and how we might work with them. And secondly, it also allows us to be more proactive in responding to patients where we're actually seeing evidence of a deterioration in their functional status, and then looking to think about how we might try and alleviate that. I think the critical thing is around the process and building relationships with colleagues locally on the ground, and that would be around community mental health teams, social work, district nursing, the voluntary and independent sectors, and I guess some of that will be around economies of scale, because clearly it may be difficult for social work and indeed other colleagues to support a whole range of individual practice-based meetings. So perhaps, depending on local circumstances, a decision may be made to implement field meetings at a cluster level. But I guess that's for people, colleagues individually, to reflect on the local circumstances and agree what might be the way forward. But I think certainly it is a real catalyst to building effective working relationships with colleagues on the ground, and indeed a greater understanding of what it is colleagues actually do and some of the services that we provide, because often we're not as cognizant of that as perhaps we might be. The meetings have been well received, and inevitably it's not just about the business taking place at the meetings. As you build relations and and are able to contact colleagues through secure email, then the amount of business that takes place away from the meetings increases. So it's I think it is just about building relationships are absolutely critical.